Hey guys, today we're going to be talking about
menopause,
osteoporosis,
and hormone replacement therapy.
Are you a woman in your 40s or 50s experiencing irregular menstrual cycles?
I believe I am.
Are you experiencing frequent fatigue or mood swings? Do you have extreme hip, wrist, or spine pain? Or maybe you find yourself waking up in the middle of the night, drenched in sweat due to hot flashes.
I believe I do.
If so, you may be a woman experiencing menopause. Menopause occurs in 3 phases. The first is perimenopause, which occurs whenever your period may seem to have stopped, but if it hasn't stopped for a total of 12 months, it'll come back again and it's considered perimenopause. Menopause occurs after 12 months without a period consecutively. This occurs whenever your LH and FSH levels rise and your estrogen levels are going to go way down. If you're a woman between 40 and 55 years old, that's probably going to happen to you. So, once you're postmenopausal, your hormone levels will never be suitable again to have pregnancy.
If you are having signs and symptoms of menopause, the first thing you need to do is book an appointment with your healthcare provider. Some things you need to expect when you go see the doctor is a review of your signs and symptoms to determine if this is menopause related, and then you're going to do some blood tests to check your FSH and estrogen levels.
Some lifestyle activities that you can do to help with menopause include keeping cool, decreasing alcohol and caffeine consumption, practicing relaxation techniques like yoga, and eating a balanced diet.
There are 2 types of hormone therapy used to treat menopause. The first is progesterone estrogen therapy. This hormone therapy is used for women that still have a uterus.
Man, I love having a uterus.
This is due to the higher risk of uterine cancer when just using estrogen. Progesterone helps to decrease the endometrium and make it thinner. The second type is estrogen therapy. Which is used in women without a uterus.
They're so overrated.
Hormone therapy increases the levels of estrogen that sharply decrease during menopause. This will help decrease the risk of osteoporosis.
Some other drug therapies we can use are vaginal estrogen to decrease vaginal dryness, and then we can also help with the hot flashes with gabapentin, clonidine, and low-dose antidepressants. A few other things we can do to strengthen bones is vitamin D and other osteoporosis prevention medications.
Say you have a menopausal patient in the hospital. Some interventions you can do to help with hot flashes include taking off the blanket, another intervention includes cool rags, ice packs can also help with hot flashes.
Here's an ice pack.
Thanks.
Fans are also helpful.
I feel so cool.
Education is also super important. You can educate your patients to increase their sleep, increase exercise, quit smoking, and then eat a balanced diet.
Do you feel educated?
So educated.
Hey guys, I think it's getting a little dark out here. Let's head into the crib. talk about osteoporosis. Welcome back. I think we all know that being a woman in your 50s is just not it. With the empty nest syndrome, Botox bills, and gray hair, why do we have another thing to worry about? That's because osteoporosis is very common in menopausal women. This is due to low estrogen levels. So, what happens whenever your estrogen levels are low? Your bone strength is going to decrease, which is going to lead to bone fractures. These are very common in your hip, wrist, and spine. Let's bring in an injury expert to give us the lowdown on all the osteoporosis signs. Welcome, Kirsten Dill, everyone. Welcome. Take a seat. Now, I know you have a lot of experience with injuries, so let's just get into it. Tell us all about it.
With osteoporosis, there may be no signs and symptoms in early stages, but later stages will show stooped posture, bone fractures, lower back pain, and slow bone fracture healing.
Why won't it heal already?
That sounds pretty terrible to me. I guess you have to go to your next doctor's appointment. We'll see you soon on another episode. Thank you.
The goal of osteoporosis treatment is to slow or stop bone loss and to improve bone density. Several ways to do this are by taking medications such as biphosphonates and hormone therapy, such as denosumab, ralofenine, and testosterone. You can also take calcium and vitamin D.
Speaking of hormones, we have our estrogen therapy, and that can come in forms like pills, creams, vaginal rings, vaginal tablets, patches, and spray. And then for our estrogen progesterone therapy, that can come with pills or in a patch. And some side effects to look for are monthly bleeding, irregular spotting, breast tenderness, mood swings. And there are some less common side effects like fluid retention, headaches, and skin discoloration. There are also some reasons we cannot take these hormones and some risks involved. But I think Kirsten is done with her doctor's appointment, and I'm going to let her tell you about it. Come on in, Kirsten. Good to see you again.
Some contraindications include hepatitis C, breast cancer, recurring blood clots, history of stroke, MI, and vascular disease. The hormone therapy risks include heart disease, stroke, blood clots, breast cancer. The risks vary based on your age, type of therapy, and health history. Another fun fact is that it's best that you start the therapy within 10 years of the onset of menopause.
Action.
Let's talk about how menopause affects reproductive health. Due to low levels of reproductive hormones in postmenopausal women, the ovaries no longer can release eggs. So therefore, postmenopausal women are infertile and unable to conceive a child. Because of this, birth control is no longer necessary.
Yay!
IVF, in vitro fertilization, can still be an option for postmenopausal women. However, increased age will come with high risks for pregnancy.
This video was brought to you by
Kirsten Dill,
Doug Regier,
Autumn Foster.
Brenna McGurk.
Now here's some bloopers.